Hello and welcome back. Today we are going to explore a common but often misunderstood chronic disease, asthma. Whether you are someone living with asthma, caring for a loved one, or just curious to learn, this video will give you a complete, easy to understand overview. Asthma affects over 260 million people globally. According to the World Health Organization, it's one of the leading causes of hospital visits, school absences, and missed work days. But the good news is, with the right knowledge and care, asthma can be controlled effectively. So let's take a deep breath and begin our journey through understanding asthma. Asthma is a chronic inflammatory disease of the airways in the lungs. It causes the airways passages to become narrow, swollen, and filled with mucus. This leads to repeated episodes of wheezing, coughing, chest tightness, and shortness of breath. Importantly, asthma symptoms come and go. They can range from mild to life threatening. Some people experience only occasional symptoms, while others may have them daily. What makes asthma different from other respiratory diseases is that it's reversible, either on its own or with treatment. The exact cause of asthma is not fully understood, but it is believed to result from a combination of genetic and environmental factors. However, there are several well known triggers that can make asthma worse. Allergens such as pollen, dust mites, pet dander, and mold. Irritants like smoke, pollution, strong odors, and cold air. Exercise, especially in cold or dry environments. Respiratory infections such as the flu or a cold. Emotional stress, certain medications including NSAIDs and beta blockers. Weather changes, especially sudden temperature drops. Understanding your personal triggers is the key to managing the condition. Several risk factors make a person more likely to develop asthma. Family history of asthma or allergies, childhood exposure to allergens, respiratory infections during early childhood, living in urban or polluted environments, smoking or exposure to secondhand smoke, and obesity. All these risk factors can cause the asthma. Additionally, children, females, and people with other allergic conditions like eczema or hay fever are at a higher risk. Asthma is not a one size fits all disease. It comes in several different types. Allergic or extrinsic asthma, triggered by allergens. Non allergic or intrinsic asthma, caused by stress, infections, or irritants. Exercise induced asthma, occurs during or after physical activity. Occupational asthma, caused by workplace exposure. Nocturnal asthma, symptoms worsen at night. Cough variant asthma, present mainly as persistent coughing. Knowing your specific type helps tailor treatment effectively. Let's understand what happens inside the lungs. In asthma, the lining of the airway swells and the muscles around the airways tighten, and mucus overproduction makes breathing even more difficult. These three factors combine to narrow the airways and cause difficulty in breathing, especially during an asthma attack. The most common symptoms of asthma include shortness of breath, wheezing, a whistling sound when breathing, persistent coughing, especially at night or early morning, chest tightness or pressure, trouble sleeping due to breathing issues. These symptoms may worsen in response to specific triggers and often improve with inhaler use. If left unmanaged, asthma can lead to serious complications such as frequent hospitalizations, decreased ability to exercise or work, lung infections, airway remodeling, which means permanent narrowing of the airways, life threatening asthma attacks. This is why early diagnosis and continuous management are vital. Asthma is diagnosed using a combination of medical history and physical exam. Spirometry measures how much and how quickly you can exhale. Peak flow test detects airway narrowing before symptoms start. Allergy test to identify specific triggers. And the methacholine challenge test checks airway sensitivity. These tools help confirm asthma and assess its severity. Doctors classify asthma into four categories. First one is the intermittent asthma. This means symptoms less than twice a week. And the second one is the mild persistent asthma. Symptoms more than twice a week but not daily. And the third one is the moderate persistent. Symptoms daily affect activities. And the fourth one is the severe persistent asthma. Continuous symptoms and frequent attacks. Treatment is based on the levels of severity and how well symptoms are controlled. Managing asthma start with a lifestyle changes. Identify and avoid non-triggers. Maintain a clean home and reduce the allergens. Use air purifiers if necessary. Quit smoking and avoid smoke exposure. Get flu and pneumonia vaccines. Manage stress through breathing exercises and mindfulness. A healthy lifestyle supports better asthma control. There are two main types of asthma medications. First one is the quick relief medication and the second one is the long-term control medications. The quick relief medications such as albuterol inhalers used during attacks and the long-term control medications include the corticosteroids, leukotriene modifiers and long-term acting beta agonists. Inhalers are the most common and effective way to deliver asthma medications. It's crucial to learn the correct technique to ensure proper drug delivery. An asthma action plan is a personalized, written plan developed with your healthcare provider. It outlines daily treatment schedule, how to monitor symptoms and peak flow readings, what to do during worsening symptoms, when to seek emergency care. It empowers patients to take control of their asthma confidently. An asthma attack is a medical emergency. Signs include severe breathlessness, inability to speak full sentences, bluish lips or fingernails, no improvement after using a rescue inhaler. Call for emergency help immediately if these signs occur. Prompt treatment can save lives. With proper management, most people with asthma lead normal, active lives. Regular checkups, medication adherence, and avoiding triggers are key to long term control. However, asthma requires lifelong monitoring. Even when symptoms seem to disappear, it is a chronic condition, not a curable one, but certainly manageable. Asthma not only affects individuals, it is a public health concern. It burdens healthcare systems with emergency visits and hospital stays. It affects productivity in schools and workplaces. It increases healthcare costs, especially in low income settings. Raising awareness, improving access to care, and patient education are essential public health priorities. Let's summarize what we have learned. Asthma is a chronic but controllable airway disease. It can be triggered by allergens, irritants, or infections. Symptoms vary but can be managed with medications and lifestyle changes. An asthma action plan and regular follow ups are critical. Knowledge is power. Knowing your triggers, treatment options, and how to respond during an attack can save lives. That's it for today. Thank you for watching this video. If you found this video helpful, please like it, share, and subscribe to stay updated with more health focused educational content. Stay healthy, stay informed. I will see you in the next lesson.